So we are going to be doing the anterior tibialis or dorsiflexion range of motion test. What we're going to have our partner do is just sit up nice and straight and have their legs dangling off the edge of the table. And what we're going to do is we're going to go ahead and palpate for the lateral malleolus. We are going to have our axis of rotation right there. And we are going to have our stationary arms positioned right smack dab at the midline of the fibula, and our mobile arm aligned with the fifth metatarsal. And whenever your patient is ready, go ahead and have them dorsiflex. Awesome. Making sure to keep it nice and parallel with that fifth metatarsal. Let's see. Our angles were 10, and normal range of motion is going to be 15 for dorsiflexion.
So now we are going to be performing the range of motion test for the thoracolumbar flexion. With this one, we can have our patient stand nice and tall on the ground. And what we're going to do is palpate for the C7 or cervical spine 7. And with that, we're going to go ahead and grab our tape measure starting at the C7, align down the spine all the way till the S2 or sacral spine number 2. And with that, whenever they are ready, we're going to go ahead and direct them to reach down towards their toes. And the measured difference between the initial starting point and where they ended with bending over is going to be their value of thoracolumbar flexion. Normal values are about 10, and she had a measured value of 6 centimeters.
Range of motion test. What we're going to first start with, make sure your partner is lying prone, face down. And first thing you're going to do is going to palpate for the greater tubercle. That's going to be your axis of rotation. And you're going to have the stationary arm centered down your thorax, and then the mobile arm is going to be the midline of the humerus. And whenever you are ready, go ahead and start. Awesome, awesome. Thank you so much. We are at exactly 60 degrees. So we're going to be performing the anterior tibialis manual muscle test. What we're going to have our partner do is just lie supine on the table for me. We're going to have her scoot all the way down so her feet are slightly hanging off the table. And then what we're going to do is we're going to assist or tell our partner to go ahead and invert their foot and also go into dorsiflexion. And then what we're going to do is we're going to put a hand on the ankle and then also a hand at the dorsum of the foot. And whenever they are ready, we're going to go ahead and resist them in a outward or eversion, and also plantar flexion. Ready, set. Awesome, awesome, and that was a grade 5. So we are going to be performing the manual muscle test for the rectus abdominis. What we're going to have our partner do is just lie supine on the table, and next we're going to have them go ahead and position their arms right behind their head. And we are going to instruct them to go ahead and curl into themselves, just lifting, making sure that their inferior angle of the scapulars are off the table. If they're able to do that, that is a grade 5. If they're not able to get their inferior angle of their scapula off the table, we are going to instruct them to go ahead and try crossing their arms above or over their chest and have them perform the same thing, just curling in. Awesome. Hers came off on grade 5, but we're going to demonstrate grade 3 as well in case they did not have an inferior angle of their scapula get off the table. So for a grade 3, you're going to go ahead and put your arms nice and relaxing next to you and try to curl into yourself. Awesome. And that is all 3 grades. So the mounting muscle test that we're going to be performing next is going to be the Latissimus dorsi. With that one, you want to make sure your partner is lying prone on the table, making sure that our arms are nice and straight and that our palms are facing up towards the ceiling. Next, you are going to instruct them to go ahead and depress their shoulder, trying to reach down as far as they can. You're going to put a stabilizing hand right above the wrist and another right above their elbow. And then with them, go ahead and depressing their shoulder, we are going to be pushing in the upward direction, trying to force them up. Awesome. And she did great. She's a grade 5.